Good morning, everyone, or good afternoon, good evening, from wherever in the world you may be joining us. Welcome to the Global Heat Health Information Network 2020 Virtual Dialogues. I'm Joyce Shumate-Guillemot from the WHO-WMO Joint Climate and Health Office in Geneva, Switzerland. I'm joined today by Julie Trutron and Hunter Jones from NOAA, the United States Oceanic and Atmospheric Administration, and together we co-coordinate the network. And we thank you all for joining us for these virtual dialogues. And while the webinars cannot substitute from an in-person conference that was scheduled to happen this week in Copenhagen, we do hope that you enjoy these dialogues. And we have transformed the program that we intended in person into a series of online webinars that take place yesterday and today, the dialogues, as well as a masterclass training series that's been running over the last month. So we'll be focusing on two cross-cutting issues in the dialogues that emerged from our first forum that took place in Hong Kong in 2018, where we formally launched the network. And the first of those issues was cities, that we needed to address urban heat because cities are experiencing urban heat islands and are disproportionately warmer, and it's it's the location where over 50% of the global population now reside. So yesterday we had a fantastic conversation about urban issues, and I invite you to all look at our website to see those materials that have all been posted now in case you missed the conversation yesterday. And today we're going to be looking at the second cross-cutting issues, which is the impact of heat on the global workforce and how to protect workers not only from heat illness, but also lost income and productivity. So the GHIN Dialogues this week are intended not only to be a review of the state of science and what we know, but they also aim to highlight the innovations that are happening in the field and direct our attention to some issues that need additional investment and attention. But most importantly, we hope that by having these dialogues, it gives us the opportunity in place to simply talk about these issues, and it becomes clearer how we should all be working together on these issues. So again, welcome to everyone. We're really glad that each and every one of you are here and part of this conversation, because wherever we are in the roles and institutions that we work in, we are all part of solving this complex issue. So I would now like to pass to Julie to quickly introduce the network and its vision, and then I will tell you a little bit about what the network is doing before we jump into today's program on heat in the workplace. So over to you, Julie.
Great, thank you, Joy, and good morning, afternoon, evening to all of you. Thank you again on our collective behalf for joining us for this conversation. I'm really pleased to be here and to tell you a little bit about why and how GHIN got started and how we see ourselves. So you're here obviously because you have an interest in heat in the workplace, or you wouldn't be on this webinar. But if you look at the broader issue about heat overall, you know, we do know that we are going to have increases in heat, increases in extreme heat waves. We're already seeing that. We know that the impacts are not just during a heat wave, but there are impacts on multiple timescales and decisions that can be made to reduce those impacts, also decisions at multiple timescales. We also know in the world that there's so much happening. So many people are doing research on heat and whatever the impact is. Many people are working in their cities and communities to try and build interventions and do longer term strategies. We just weren't working well enough together, quickly enough, learning from each other to really tackle this really pressing problem. So we know that heat is one of those things that isn't even often perceived as a disaster, and yet is the biggest silent killer we have. So GHIN was created to really connect the global community working on heat on multiple timescales so that we can better raise awareness of the problem, deal with the really urgent nature of having to address this quicker, more rapidly than we are. How do we actually learn from each other, share information, co-produce knowledge, and build capacity, whether it's in a city, community, in a leadership, or in a sector, like architects and engineers or the workforce? How do we actually manage to propel ourselves further, faster together? And this network, in very short order here, was designed to really bring the global community together to have this conversation, but also to help us figure out what's working in terms of intervention, what should we be predicting. So even from the climate and weather side of the community, there's a lot of conversation about what are the important parameters to predict. So GHIN is really the global place for this conversation. We're really pleased that the WMO-WHO Joint Office is hosting it and happy to be helping support it. Really happy to have you all here today and hope that you will stay connected with us after this particular conversation. Joy will end both this part and the session with some ways that you can be engaged with the network following this. So looking really forward to the discussion. Thank you for being here, and back to you, Joy.
Great. Well, thanks, Julie, for that context. Now, who are we as a network? Well, we have a broad range of collaborating and supporting partners of GHIN. Here you see a few of the founding members. And we particularly have a very strong representation from public health agencies, as well as national meteorological services, because we're leveraging the policy and technical channels of the World Meteorological Organization, as well as the World Health Organization. We also have wide-ranging partners from academia on all continents, as well as NGOs and other international organizations, as well as private sector partners that are increasingly getting involved. But very important to us, the members are coming not only from diverse sectors and interdisciplinary backgrounds, because we need that diversity of perspectives and knowledge, but they're also coming to the table with compatible motivations and particularly shared principles around integrity in science and using the best available knowledge for decision making around risk management and protecting public health. These are our common goals of all of our members. And featured here, you see a few of who we have been working with, but coming up in the fall, we will be launching a new website, and you will see more information about how to formally join the network and what being a member means. So what are we focused on? Well, responding to the gaps that Julie mentioned, the mandate of the network really came together at our first forum and are described in this call to action. And it really asked that the network needed to come together to urgently improve awareness of this silent issue. First and foremost, we need to bring attention to the vast and wide-scoping impacts that heat is posing on human health, both in the immediate and in the long term in the context of climate change. But that we also need to be building partnerships that are fostering the interdisciplinary co-learning and collaboration, particularly between research and practitioners and science and policy. That we also need to be focused on synthesizing knowledge and information that we do have available today for better decision making in whatever that application or sector may be. And that we need to, as a network, help connect up the expertise that we do have across the world and across these varied communities, making that more available so we can accelerate the learning from each other, the exchange that we have, and really move the needle on developing capacity for addressing heat risks. But then finally, that the network needs to be providing leadership, and particularly thought leadership that can help identify and promote action into the critical gap areas of research, early warning systems, into intervention effectiveness. That's the real mandate and purpose of the network. So how do we do this? Well, we have decided in the first 18 months of the network to focus on a few key activities. And so we are developing an online platform of resources and country exposure profiles. We've developed some global synthesis products, knowledge products, and are really still committed to bringing the community together for biannual conferences. as well as having regional and thematic workshops and trainings. We've also started this year to stand up technical working groups for specific activities. And we're going to continue to do this, but we also think that we're going to start moving in the direction of supporting regional communities of practice and partnering more widely with other research and technical agencies so we can really start scaling up our activities on the ground. Just a few examples of what we've been up to just this year. Earlier in February, we had a South Asian Heat Health Summit in India, working with partners to look at the progress that's been made on the Indian subcontinent, which has been very rapid in the last 2 years, and how we can support and establish a sister network for the South Asia region. We had an innovation workshop in the Netherlands looking at how do we bring in new technologies for heat adaptation. And in May, in response to the global coronavirus pandemic, we anticipated that there were going to be a lot of challenges in managing heat waves during COVID-19. And so we were able to pull together over 70 experts in a very short amount of time to produce evidence reviews and guidance on 15 topics to help people make decisions on how to manage heat during COVID. And it really showed the collective strength of the GHIN community and the value of the multidisciplinary partners. Of interest to this group, we also looked at how to protect health workers from heat stress that are wearing personal protective equipment. Very proud of the network in this work that we were able to do. And then we also brought 4 classes online. The materials are publicly available as a master class series that is part of our virtual forum this year. Coming up, a few things to look forward to is that next month we will be launching a brand new website. We're very, very excited about this because it's going to give us a lot of new functionalities and information and resources. We will have communities of practice and focus areas, including one on occupational heat risks and heat in the workplace that will parallel this conversation we're having today. But we're going to have a lot of new material. But of course, we depend on you as part of the network to share with us what's happening, new projects, new findings, so that we can help give you visibility and others can learn from you. So look out for that. And then 3 other things is that we will be starting open forum teleconferences starting in September. That will be open lines for anyone in the world to call in to help us better coordinate, share information. We'll have a thematic calendar for every month of what we're going to discuss and invite everybody to tune into those. We'll also be launching a new masterclass series. And depending on the state of the world, we do hope to convene a 3rd global forum sometime next year, depending on the possibilities of that. So for now, let's just get started. So let me hand over to Professor Jason Lee from the University of Singapore. He is also the chair of the International Commission on Occupational Health, their scientific committee on thermal factors. So he's going to introduce us and lead in the main event today, Heat in the Workplace. So over to you, Jason.
Thank you, Joy and Julie. Hello, everyone. I see many familiar names in the attendees list. That's awesome. I'm Jason Lee, currently an associate prof based in the School of Medicine at the National University of Singapore. I'm actually a thermal physiologist by training. Before I give an overview of what lies ahead in the coming 2 hours or so, I want to take just a couple of minutes to thank my co-workers who have helped and are still helping to prepare this dialogue. In addition to Joy and Julie, I want to thank Elspeth, my partner in crime in this effort, Hunter, Brooke, Julie from Climate Center, and Maddie, of course, for the beautiful slides you are seeing and the work on even more impressive new GHIN website to come. And of course, a huge thank you to our moderator for this event, Megan, and our three speakers and panelists, Tamina, Andres, and Jerome. Thank you for sparing your time. The main goal for this HIT in the Workplace Dialogue is to provide a rapid tour through key and recent developments in the world of occupational heat health. A panel of three experts and practitioners will share short presentations on the state of the science, new research outcomes and practices on the often underlooked workers' populations and practical interventions for occupational heat health. Personally, from where I'm based in Singapore, I'm indebted to many of the migrant workers who have literally built and are still building my country, often under chronic heat stress. Without them, I would not be able to live in such comfort. So this is a key reason that keeps me going in my daily work. All right, so bear in mind, after each 15 minutes lecture, we'll allow a short 5 minutes for questions specific to the presentation before we move on to the next lecture. I hope by doing so, we can keep everyone engaged throughout. So do utilize the Mentimeter to submit and vote for your questions. After that, these presentations will be followed by a facilitated panel discussion with opportunities for you to interact and engage via questions submitted upon registration and during the session, again via Mentimeter. Just a gentle reminder that this webinar is being recorded and will be made on the GHIN website as soon as possible. All right, let me introduce Ms. Megan Rowling, our moderator for this event. She's based in Barcelona. Megan is an experienced climate correspondent and editor with Thomson Reuters Foundation. She specializes in humanitarian and development issues, including climate change, disasters, and resilience. She was previously with Reuters Television and the BBC, and has written for a range of newspapers and magazines. Over to you, Megan.
Thanks very much, Jason. So yes, I mean, at the Thomson Reuters Foundation, which is the charitable part of Reuters News, we've been covering climate change for well over a decade. And I think when I think back, heat as such was something that we didn't look at very often. Drought was something separate. But how this is playing out in our own coverage now, well, I was thinking about that this morning. And we did do a package of in-depth stories on the issue of rising heat in 2017. And as Joy said, the top sort of line here was that it's an unseen killer because it's an invisible, hard-to-document disaster, often claiming lives largely behind closed doors, and because hot weather just doesn't strike a lot of people as a serious threat. I mean, as part of this package, we did cover challenges facing migrant labourers in the Middle East, many of them from South Asia, and rickshaw drivers in India, for example. And we also looked at some of the potential solutions, whether those were cooling vests for construction workers in Qatar and Dubai that were being tested by a global contractor called Multiplex at the time, or cooling gel-filled collars that were being worn by street cleaners in Dubai too. And then also we had another story that touched on Indian rickshaw drivers who've added wet cooling mats to their vehicle roofs so that they could bring in more customers and boost their income in a more comfortable environment. But in general, I'd say that this topic still doesn't get a lot of coverage in the international media, although today, good timing, I did get a press release from the Red Cross with warnings about high heat in Europe in the coming days and what to do about that. And then, of course, last July, we had this International Labour Organization report on heat in the workplace, which said that an increase in heat stress resulting from global warming was projected to lead to productivity losses worldwide equivalent to 80 million full-time jobs in 2030. And that was actually under a conservative global warming scenario of a rise of 1.5 degrees Celsius, which I think Tamina will be speaking more about that report shortly. And among the sectors hardest hit are going to be agriculture and construction, and some of the poorest regions of the world are likely to lose the most working hours, including in South Asia and Western Africa. And South Asia really does seem to be likely to suffer a great deal. My colleague recently wrote a piece on new research saying that street vendors in India are suffering from lower earnings and bad health because they're losing access to shade in cities where trees are being basically cut down to make way for construction. So, I mean, when we can, we do write about this issue. And I think in the mainstream media, which we don't see ourselves as, we see a lot of interest around sports, which maybe most people don't think of as occupational health. But I was reminded of all the discussions around the Football World Cup in Qatar and how they're going to try and reduce the heat stress there. And also there was an incident last summer when there was the death of a worker on a Tokyo Olympics construction site due to heat stress. And so when we see these things sort of hitting the headlines, I think people start to realise that this is becoming a bigger problem, and it's likely to rise up the agenda as the world gets hotter. And so to talk to us about this issue today, we have our three speakers who are on the slide in front of you. So I won't go through them now because I will introduce them as they come up to speak. But before we start, we wanted to just bring in the audience. We would like this to be an interactive session. And to do that, we're going to use an app called Mentimeter, which some of you may well already be familiar with. And this gives you a chance to tell us about yourselves and provide us with some inputs on who's tuned in today. So if you would like to participate in that, you should open up a new browser window on your computer or go on your phone and head to www.menti.com. That's MENTI.com. And then you'll need to enter the code at the top of the screen. And the code for this event is 577800, which I think you can probably see on the screen now too. So you put in your location, and then you will see that we are going to ask you to answer a couple of questions. The first one is, which country are you joining this session from? I think that's a fairly straightforward one. So if you would like to type that in, that will help us know who is listening and where from, and so perhaps that's an indication of where this is being seen as a key issue. And then the second question, and you can see that on the word cloud actually now. And then the second question that we're going to ask you today is, what is your primary sector of work? You'll see the different categories: agriculture, construction, mining, emergency services, transport and logistics, service industry, military, law enforcement, etc., etc., etc. And then we would like to hear from you about your primary concerns about occupational heat health and some of the issues that you would like to see addressed today. And so what we're going to do as well, in terms of sourcing questions from the audience for our panelists, is that we'll ask you to put your questions into the Mentimeter, and it's possible for people to vote on which questions they would like to see answered the most. So as we're trying to be democratic about it, we will attempt to get the questions answered that are the most popular concerns among the audience today. So I think, as Jason already mentioned, what we're going to do is we're going to let each of our presenters speak for about 15 minutes, and we'll have 5 minutes for questions for those presenters. So it'd be good, I think, if you could submit questions that are specific to those topics. And then in the panel discussion afterwards, we can move to broader issues. And I would like to ask that if you do have specific questions for specific speakers during the panel discussion, it would be good if you could mention who they are for. Otherwise, we'll treat them as general questions, and the speakers can dive in and answer as they feel fit. So with that, I'll leave the Mentimeter to the audience to work on, and we'll start with our presentations. So our first speaker today is Tahmina Karimova from the International Labour Organization. Her talk is going to be a global overview of heat impact on worker productivity and policy opportunities. So drawing on that report that I mentioned earlier. So a quick intro to Tahmina. She's a lawyer specialized in labor law and human rights law. She joined the ILO's research department in 2017. And before that, she was the ILO National Coordinator for Tajikistan. And from 2014 to 2017, she worked as a human rights officer in the Office of the High Commissioner for Human Rights. So with that, Tahmina, I will turn it over to you and your slides and your talk. Thank you very much.
Thank you very much for this introduction. And first of all, before I start the presentation, I would like to say thank you to the organizers of this webinar for inviting the ILO to present some of our research findings during this debate and the dialogue. And this is a glimpse of what the ILO has been doing in the area of climate change and environmental degradation, especially its intersection with the world of work. And today I would just focus on the specific issue related, or the specific result of the global warming, which is heat. I wanted to start with some generalities, and also to let you know that hopefully this presentation provides a good background for our ensuing discussion, and will give some background for us to continue our debates. First of all, as you have already heard in the introductory remarks to this webinar, climate projections point towards an increase in the frequency and intensity of extreme weather events. And one result of this trend is, of course, the loss of jobs and productivity. So the ILO has made a report, which Ms. Rowley already has introduced, which was released in 2019, entitled Working on a Warmer Planet, the Impact of Heat Stress on Labor Productivity and Decent Work. And this report has provided some results and some research findings that could be of use for a broader international community in leading policy and practice discussions on how to address the heat at the workplace. Before we start the discussion of some numbers and the magnitude of the problem, I wanted to just give you a brief overview of what do we mean by heat stress. When we say heat stress, it refers to a situation where it is too hot to work or too hot to work at a normal intensity. So it is generally estimated that productivity of workers start to decrease at 25, 26 degrees, and at 35 degrees Celsius, the productivity of a worker with moderate physical effort is divided by 2. Exposure to excessive heat levels, of course, can lead to heat stroke, sometimes even with a fatal outcome. I should say, as already has been said in the introduction, workers in all sectors are affected. But of course, certain occupations which are especially at risk are those occupations that involve more physical effort, and they take place outdoors. Such jobs obviously are found in agriculture, environmental goods and services, in refuse collection, in transport, tourism, sports, emergency repair work. Also, we should say that heat affects the workers in the industries, in the indoor settings, and when there are high levels of heat, performing even basic office desk tasks become difficult, because there is also a mental fatigue that kicks in. So with this in mind, the ILO has attempted to calculate the impact of heat stress under a conservative scenario of 1.5 degree. Just a reminder for everyone, 1.5 degrees scenario refers to a global temperature increase by 1.5 Celsius degree by end of the century compared to the pre-industrial era. We find that on average, working hours lost will rise to 2.2% compared to 1.4% in 1995. If we translate this percentage into working hours lost, or let me correct myself, the working hours lost, if we translate it into full-time jobs, we estimate that this translates into 80 million full-time jobs worldwide that will be lost due to heat stress. This assumption, the way it has been phrased earlier, is that it's a modest assumption, and we call it conservative as well, simply because it is based partly on the fact that in tropical countries, I would say that it rests on the assumption that agricultural and construction work, as well as other types of work factored in this estimation, is carried out in the shade. So we did not calculate the impact if the work is carried out in the sun. Why we did so is, first of all, is partly because in tropical countries, about 40% of the days are cloudy, they are not sunny, and partly on the fact that some tasks, especially in subsistence agriculture, can often be moved to times when there is less hot. If we take an assumption that the work is carried out in the sun, the projected loss of working hours worldwide in 2030 goes up twice as much. To be more precise, the percentage of working hours lost will be 3.8%. This is equivalent of 136 million full-time jobs. But going back to this conservative assumption of the 2.2% of working hours lost, if we can also translate it into the GDP loss. If we do so, our calculation shows that global GDP loss will be 1.4% by 2030, which is equivalent of around 2,400 billion, again by 2030. In the chart that you can see on your screen, you see the percentage of working hours lost by region, as Megan has already noted, and here you can see in the dark red columns the regions that will be worst affected by the heat stress. These are in particular the Southern Asia and Western Africa. And in the next slide, I would like to draw your attention to the data related to the workers in the specific sector. So we can see here that agricultural and construction workers are among the most affected due to heat stress. And for the majority of the sub-regions, agricultural workers contribute to more than half of the total working hours loss. What is also important to note that is heat stress is more prevalent in countries with decent work deficits. To be more precise, countries that are most affected by heat stress have higher rates of working poverty, informal employment, and subsistence agriculture. In addition, we should say that disadvantaged and vulnerable population groups and communities, including indigenous and tribal peoples who are dependent on agricultural coastal livelihoods, are at greater risk of suffering the adverse consequences of rising temperatures. In the slide that you are seeing currently, we have identified that from the 10 countries worst hit by our predictions, 8 out of 10 are also least developed developing countries. Here we have to summarize that as a result of the heat stress, some countries will be particularly hard because of not only weather conditions and climatic changes, but also due to multiple factors related to their economic structure, as well as the sectors that are prevalent in these countries. We have identified that among these countries, Benin, Burkina Faso, Cambodia, Chad, Sierra Leone, Sudan, Togo, Niger, all least developed countries will be hard hit by heat stress. And obviously, it points out to another sad consequence of the heat stress is that it's going to increase inequality as within countries as between countries. In this chart, you can see that Cambodia is projected to lose 7.8% of working hours, which is equivalent to 769,000 full-time jobs. For a country with a large population, as in the case of Thailand, this loss is equivalent to 2.5 million full-time jobs. We also have to note that, as I said, there is multiple factors that are in play. Not only these other countries would be worse affected by the weather conditions, but also because in these countries there is more prevalence towards sectors such as agriculture. And I think that there's these multiple factors that are in interplay, which even translates into more vulnerabilities. I should also say that in the beginning, when I was trying to give you some summary of what is considered to be a heat stress, it is important to note that as a consequence of its effect on the worker and as workers' health and safety, heat stress can be considered as occupational hazard. Next, I would like to also, as I already said, that heat stress concentrates in regions with existing decent work deficits. And there is a lot of inequality that is going to be deepening as a result of that. Another dimension that is very relevant to note here is that there is a gender dimension to this exacerbation of inequality, meaning that women are most prevalent in subsistence agriculture. As a result, they will be the ones who are more vulnerable. Another factor that we have discussed in the report, and this is the finding that is corroborated with other research in the area, is that heat stress is a driver of migration. The reason I think it is important to have this very detailed and elaborate understanding of the situation, because the response strategies within countries regionally and globally would also have to take into dimension the ones that were worst hit by heat stress consequences. Here we can see in the slide this correlation between labor productivity loss due to heat stress and social security system. As I noted in my previous slide, there is a correlation between the countries worst hit by heat stress as well as the decent work deficits. There is also a productivity loss due to heat stress, which is concentrated in countries and subregions that I mentioned before. Our analysis shows that a negative correlation between productivity loss and social security coverage is also present. We also find a positive correlation between productivity loss and vulnerable employment. For example, own account and contributing family workers, share of working poverty, and share of informal employment. If you recall, considering the two sectors like construction and agriculture that are most impacted by the heat stress, we also have to take into consideration these are the two sectors where there is a prevalence of informality and vulnerabilities among the workers. In Africa, for example, 75% of the population has no legal health protection, and every third worker earns less than $1.90 a day. Excessive heat levels also aggravates inequality between rich and poor countries and between groups of the population within the same country. This is the finding that we make. And for example, to give you a more concrete setting, migrant agricultural workers in Latin America and the Caribbean, vendor street workers in Asia, and migrant construction workers in the Gulf countries represent the type of workers that we consider would be most vulnerable to the effects of the frequent heat stress, frequent weather events such as extreme temperatures. Heat stress is also one of the main drivers of the migration, as I noted, and therefore, as people move to minimize the effects of rising temperatures on their health, as well as to compensate for the income lost, which will be as a result of the reduced labor productivity. So in view of this situation, the question that comes up is what can be done in terms of concrete strategies, both nationally, regionally, and internationally, we think that a combination of adaptation and mitigation strategies is extremely important and are the main ingredients of any policy towards addressing the consequences of heat stress at workplace. We consider that it is important for the governments to particularly to adopt multiple policy choices in this regard, and taking a perspective of adaptation policies, there is in our report we make recommendation to all social partners, the government, employers, and individual workers, because I think that a concerted effort, collective endeavor is important because it's a responsibility of everyone. While the report details for each of these players, actors who are also drivers of change, specific sets of responsibilities and also roles, as a general measure, we consider that regulatory adjustments will be very important. And since heat stress is an occupational hazard, in this regard, both governments and employers have specific standards to adhere to. At the international level, international labor standards can provide general guidance on what can be envisaged in order to address this occupational hazard, how to address this occupational hazard, for example, the responsibility of the employers to continuously carry out the risk assessment, and also some conventions of the ILO related to the hygiene in offices and commerces specifically address some of the actions that can be done due to exposure to ambient factors such as heat. But also international labor standards that give guidance to countries who are members, but also members of the International Labor Organization. They are not limited to just dealing with the occupational safety and health aspects of the consequences of the heat and its impact on the workers, but also they provide a range of instruments such as social protection standards related to coverage, to access to medical care, for example, Injuries Benefit Convention provides guidance on how states can respond to situation where a worker has had an impact on his health as a result of exposure to heat. One thing that is also very important to note is that ILO guidelines for a just transition to environmentally sustainable economies, which really provides guidance to the states on the part of on the issues related to environmental degradation and climate change, advises that all countries and governments, in consultation with employers and workers, should carry out continuously assessments of increased new OSH risks, new occupational safety and health risks resulting from climate change. And it provides also some other advice on what would be the type of economic, social, and labor measures that can be envisaged. Also, just to wrap up,
I think we're going to be running out of time a little bit if we continue maybe to the end of the slide. I'm wondering if you could just wind up for us. Yeah. Thanks.
This is the final slide, and I thank you for flexibility and giving me extra time. In the final slide, I wanted to say that these guidelines also suggest that one of the important tools, apart from adaptation and mitigation policies, is a social dialogue, which is very crucial in reaching consensus on what working methods, what working hours, what protective equipment, what kind of breaks, and how to organize the work in the event of heat stress can be done. And I thank you very much for your patience, and thank you for giving me also this extra time. Thank you. I'm ready for your questions.
Thank you. Thanks very much, Tamina. We started a little bit late, so apologies for that. I'm just going to put one question to you as we're short of time, which is at the top of the Mentimeter list of questions, which is basically, and it touches on some of the other questions that came in too, is a technical question around how does ILO quantify the productivity loss? If you could answer that for us, that would be great.
For the purpose of this report, for the purpose of the heat stress, the way we have quantified is in the percentage. So as I said, this is a very conservative assessment. It assumes that work is carried out in the shade, and we have assessed that by 2030, if we keep the conservative scenario of 1.5 degree Celsius of increase, the number of working full-time jobs lost is 80 million full-time jobs. If we say that, but this is, we also have to think that the average temperature rise will be the same. If we say that the work is carried out in the sun, the productivity loss will almost double. It will be 3.8%. Into full-time jobs is around 130 million full-time jobs. But this is, again, two caveats. It's in the shade, it's conservative scenario, and it's let's say that it's also considers 1.5 as the temperature increase. It doesn't consider other scenarios.
Thank you very much for that explanation. There are some other technical questions in the Mentimeter list of questions. Perhaps you could have a look at those, and maybe we can try and answer a couple of those in the panel discussion at the end or separately. But I'm going to move on to our next speaker now, who is Andreas Flores from the University of Thessaly in Greece. And Andreas is going to talk to us today about learning from the formal labour sector in North America, the Middle East and Europe, and what different stakeholders, international organisations, companies and so on can do. So elaborating on what Tahmina said. Just to introduce Andreas, he's an associate professor at the University of Thessaly in Greece and an adjunct professor at the University of Ottawa in Canada. He's also the founder and director of BAME Lab. You'll see this on his slides. It stands for Functional Architecture of Mammals in Their Environment, which is a great name, for a research unit of 16 full-time researchers investigating the health and performance effects of environmental factors with a particular focus on heat. He's also currently participating in several working groups developing prevention measures to reduce the impacts of environmental factors for workers, athletes, and the general population. And he works with the WHO, the World Health Organization, the International Labour Organization, and the Greek Ministry of Labour. Andreas, please, your presentation. Thank you.
Thank you very much for this introduction. I hope everybody can hear me. Unfortunately, you cannot see me, and I must apologize for that. I'm joining through my phone, so I will try to do this as to the best of my capacity here. So in the next 15 minutes, we'll be talking about evidence-based guidelines. There's lots of data coming out, especially in the last decade, on how we can boost health and work productivity in a warming world. And in this presentation, I will try to be very, very critical and only present to you what we have the most evidence for. Although Tahmina did quite a nice job in talking about heat stress, I will very briefly give you an outline just for those who may not be familiar with it. When we talk about occupational heat stress, we mean conditions under which a worker's body is storing heat. This can happen in three different ways because of three different reasons. Essentially, if this person is working in a harsh environment, usually this means working under the sun in high temperature and high humidity, although other environmental factors also come into play. Another also potential factor is wearing insulative or impermeable protective clothing due to the nature of the job that this person is doing. And the third factor is potentially if this person is performing very intense jobs, so they're releasing a lot of metabolic heat. These three factors either work in isolation or all of them combined at the same time. And having heat stress leads to occupational heat strain. This is how we call it. And what this essentially means, this is what the body feels really. And the most easy to measure thing in occupational heat strain is essentially an increase in core body temperature. The core body temperature is the central part of our body that you see here and with the darkest red color. And when our core body temperature increases beyond 38 degrees Celsius, the data shows that we have a significantly increased probability of having a heat-related pathology. The probability that this can happen is, I have to say that it has decreased in the last few decades, primarily due to mechanization and improved clothing technologies. However, climate change obviously is not helping in this regard, but also there's other factors that cause us to still consider occupational heat stress and strain. There's a number of workers who still experience heat strain on a daily basis, and unfortunately, this is typically not recognized. So in the rest of my talk, I will focus on four main areas. I will briefly present the existing evidence we have in terms of guidelines. I will talk to you about some shortcomings and challenges that we have in creating guidelines and improving them, what we can consider for improving protection, and finally, I will finish off with some take-home messages regarding guidance. Now let's start with existing guidelines. It has become evident for several decades now that just measuring temperature, environmental temperature and humidity is not good enough to assess hazard. So hundreds of heat indices have been developed by meteorologists, engineers, and health specialists and physiologists. And the one having the largest evidence base for use in occupational settings appears to be the wet bulb load temperature, also known as WBGT. In the graph here, you see some of the thresholds for work in hot environments based on WBGT that have been released by different institutions across the world. Some of them are international institutions, some of them are ministries, and some are societies in terms of scientific societies. And what is visible here is that there is some variability. And the reason why this variability exists is because people are acclimatized to working in a specific environment. And this is easy to see if we look at studies like the one I'm showing you here, which shows the mortality curve, which is the red line in these graphs that you see in different cities across the world. And you can see that in different parts of the world, mortality rises at very different levels of temperature. For example, if we look at the bottom left in Stockholm, Sweden, mortality rises at about 20 degrees Celsius. Whereas if we look, for example, at, let's say, Madrid in Spain, it rises at about 30 degrees Celsius. So there's a major variability there. And the reason is because, of course, people acclimatize. But it's not only the long-term acclimatization that happens because people spend years and years of living in an environment, a specific environment. As we have shown in a paper that was just accepted for publication, even natural summertime acclimatization is very important. And in this study, we were able to show that individuals can acclimatize just by spending a summer in a relatively warm environment. And by relatively, I mean being in Canada, so nothing too excessive. And the most important thing here is that people who are vulnerable, such as older individuals, tend to be helped a lot more compared to younger individuals. So it is very important, obviously, to consider acclimatization. We cannot just apply one single threshold across a country, especially for larger countries, and essentially also, more importantly, for across the world. It is almost impossible to have an evidence-based threshold across the board there. It's also important to consider this when we think about workers who may be away from work for several days. For example, if they're on holiday, routine absence, or if they're ill. And more and more, it's starting to show up in guidelines that workers who are away for a few days, and you can see in this graph here, from anywhere between 4 to 5 days and up to more than 20, there should be coming back to work, but given only percentage of full work assignment on the first day and slowly getting back into work because of this acclimatization and how important it is to get slowly back into the work, because research shows that within the first 10 to 15 days of being away from working in the heat, the adaptations that we have accumulated are starting to go away. One other very important fact that we have very, very strong evidence for guidelines relates to hydration. There's lots of evidence showing that hydration is really important, and everybody in science knows that. But it's also, we have strong evidence also in occupational settings that being hydrated is helping, of course, to being able to continue to sweat, so therefore to keep our body cool. But also in the long term, being hydrated reduces the probability of having kidney disease or acute kidney injury. So guidelines such as the ones that I'm showing in this slide here are certainly backed by lots of evidence, and also with relation to WBGT that somebody can use. For example, if they're in Greece, as I am right now, being at about 28 WBGT, this graph shows that if I'm performing hard work, I should be drinking about 8 liters of water per day. And hydration is so important and so great that we can actually, that there are lots of data that we can use to also educate workers. And in this graph here, I'm showing 2 simple tools for detecting hypohydration. The one to the right is probably known to most of the attendees in this workshop, and it shows the progression of urine color. And with this, it's easy for workers to detect if they're hydrated or hypohydrated. And one graph that some colleagues have been working on recently, this is the one on the left, that uses 3 factors: the urine color that I just talked about, but in combination also with thirst and with how much weight somebody has lost. And if all these factors are appearing, it's very, very likely that somebody is hypohydrated. So we use simple tools like these to, as of course, to educate workers, but also on a daily basis to avoid hypohydration, which, as I said, is really important, and there's strong evidence about its link with disease. Now, having said that, and having shown you some of the guidelines, there's lots of other guidelines out there, but it's again really important to, when we design guidelines and when we adopt them, to ensure that there is evidence for it. It is also important to consider certain shortcomings that these guidelines have, or even more if we're trying to custom make guidelines that were developed in another country for our own country. It is important to consider a few things, and I'm going to show you 3 challenges that we have here. First of all, that it's really difficult to protect a workforce that it's changing. And here are some of the reasons, some of the ways the workforce is changing. For example, older workers are the fastest growing labor pool, and we know that these individuals are very vulnerable to working in the heat. It's very likely that they will have a heat-related pathology. It's also the same for people who are obese and have low aerobic fitness, both of which are increasing tremendously across the populations around the world. And at the same time, prevalence of chronic diseases such as diabetes is also increasing, and we know that this also affects the way that we are able to dissipate heat when we're working in the heat. So these factors are really important, and they make life difficult when somebody is trying to develop guidelines. In the graphic that I'm showing here is from a recent paper we published, where we try to create screening criteria. To the left is for women, to the right is for men, with respect to age, fitness, body surface area, BMI, and body fat, beyond which, so for example, in age, women beyond 56 and men beyond 53 are more likely to have a heat incident if they're working in the heat. However, these data to date, these screening criteria have been only validated in laboratory conditions. So it's important that we move out to the field and we validate this or even more other guidelines that may be available at some point. When we go out to the field, and I have been fortunate enough to do this in many occasions, we see that there's another challenge coming up. And the challenge is that in the laboratory, we often ask workers to work at a specific work rate, or we fluctuate work rate depending on a certain paradigm, a certain protocol. But when we go out to the field, we see that things are not as simple as that. In these graphs here, I'm showing the work intensity across different jobs in different countries. And obviously colors indicate different intensities: rest, light, moderate, and heavy work intensity. You can see that there's tremendous difference between jobs, but also within the same job, more or less, between countries. For example, if you look at agriculture, for example, in Greece, Cyprus, and Qatar, we have seen that the work intensities change dramatically. So it is obvious that we need to consider also this factor, which makes our life a lot more difficult when we're trying to create guidelines for these workers. And finally, one more challenge that I'm going to talk about relates to climate change, which is not uniform across Earth. It's not uniform across the world, but also within countries, especially if they're large enough, it is not uniform. So it's practically impossible to apply the same criteria. Sometimes you are over conservative or not conservative enough in some cases, depending again on the climate change. Now, what we can do to take these these data and what we have learned in the last decade and improve things. Well, what we have been doing is we have been creating adaptation strategies, and specifically we're focusing on 4 that we have found that there is the strongest evidence for, and that they're practical and can be actually applied in the field. These relate to work rest ratios or work rest scenarios. We're giving guidelines with respect to hydration. We're trying to use mechanization and replace jobs or support people working in jobs that are very physically intense, and obviously work with improving work clothing and personal protective equipment. We're also trying to develop guidelines specifically for vulnerable workers. But what I'm going to present to you in the next few minutes is a personalized warning system that we have been developing here in Europe. It's part of the Heat Shield project that we have been working on since 2016. It's an online platform providing forecasting guidance for about up to 30 days in advance. It is designed for workers and employers who can actually go online and create an account. They put in their login information, and then we ask them a few very basic questions about their location, potential health issues, and their profile. And then they can get a short-term forecast and guidance with respect to what they're going to, what should they be, how much water they should be drinking tomorrow based on the location and the heat, and also the work that they're doing, how many breaks they should be taking, and what the intensity should be in their work. We're trying to add a lot more guidance as we go along into this. Through the same platform, we're also sending messages on a daily basis to those to the people who register, and they can even go and log in and look up to 30 days in advance. Although obviously with a certain degree of accuracy, what's going to happen in the future. This is primarily for employers who may want to adapt their work scenarios, if they, for example, if they have a factory. We're also trying to approach these workers using a series of infographics that we have developed and translated in many different languages, either with infographics such as the one that you see here, showing information across the board, or with infographics such as the ones you see to the right, where they're there is a specific guidance targeted for different industries that we see as major, such as agriculture and construction that Tahmina talked to us about, but also other industries that are important for Europe and for Western world. And we're also trying to provide guidance to employers and to occupational health and safety experts, also again with infographics, and trying to get them on board our platform and discuss with them, bring them on board and take information from them and make this even better. And I will finish off because the time is going by. I will finish my presentation with just a few take-home messages. There's a few, some more text that I typically use here, but the important thing is to keep with the message, because I know that these slides will be posted. So what we have evidence for right now is that employers should prepare and have available at the worksite a risk assessment and heat mitigation plan. They should invest towards initial medical examination and annual health checkups for their workers. And they should ensure that they have medical safety and welfare staff available to support them. They should provide training to their workers upon recruitment and at the start of each summer period. They should provide access to fresh, pure, and suitably cool drinking water, and there's some recommended actions for that here. They should also provide shade. Again, there's some recommended actions for this as well. And finally, and this is my last slide, they should provide appropriate personal protective equipment, including loose, light-colored, and durable clothing made from breathable fabrics. And also, they should empower workers, and this is really important, they should empower workers to take breaks for cooling down in the shade if they feel they need to. Of course, the work that I have presented is a great number of people have been involved in getting this out from the Heat Shield project in Europe, but also from projects in North America and in Qatar, where I have been fortunate to work with. I'm looking forward to answering any questions you may have, and thank you very much for the invitation to talk to this wonderful webinar.
Thanks very much indeed, Andreas. It's very interesting to hear that there are so many sort of practical tools that are being developed in order to help employers to act on this issue. As we're short of time, I'm going to go with the top question on the Mentimeter, but you will see that there are actually quite a few questions for you. I'm sorry we can't get to them all now. So the top question is, how prevalent are heat-related worker safety laws around the world in your experience, and do they work? And I'll just add on to that. Has there been a shift, either as a result of laws or because of some of the work that's being done around this, in terms of companies seeing, tackling heat stress as something that they should do in order to improve productivity, as opposed to it being a sort of block to work and something that's an optional extra? Thank you.
Yeah, that's a brilliant question. I see that there's starting to be a change, and I have personally have started to see the change happening in the last few years. I think the main reason is that technology has enabled us to bring research out to the field, to go to the field and monitor very, very closely what is happening there, which shows to employers also the economic costs. Not that they're not sensitive to the health costs, but now that they are also seeing the impact on their bottom line, on the economic costs, they're twice as much likely to engage in this. And I think it's primarily the technological advances that has allowed researchers to go to the field and quantify all these things, and especially the last 5 or 6 years, that has starting to sensitize the employers to bring change.
And in terms of the legal aspect, Andreas, what do you see there? Do you see an increase in laws around heat-related work safety?
Well, in Europe, unfortunately, there hasn't been much change yet, although I am currently in collaboration with the Greek Ministry of Labor and we're hoping that we will bring a law to the Parliament within the next year, hopefully. And we're hoping that at least this will be something that will maybe create a domino effect, at least here in Europe. I have a feeling that something similar may be happening in Qatar at the moment. So, and I'm hoping that these 2 or 3 maybe instances may create a domino effect, and with networks such as GHIN and WHO, with support from all these networks and from the scientists, I'm hoping that then once the first 2 or 3 come out, it will start becoming a precedent, and we will see this more and more in the years to come.
So there's clearly a lot of work that remains to be done there, and very important too. And you'll see either now or afterwards that there were some technical questions around hydration versus rest and the different types of measures that employers and employees can take. Do you prioritise those, or does it depend very much on the context?
Well, we recently did a large project in Qatar in collaboration with the WHO, and we were actually very surprised to find there that workers were empowered to take lots of breaks. And this, I have to say that it debunked a lot of the myths that at least we were going in the country having in mind. We expected to see a lot more, a lot higher core temperatures and a lot higher incidence of hyperthermia and occupational heat strain than we actually did. We did see those, but in very few companies where workers were not empowered enough to take breaks. So, if you ask me, I think that especially in construction and agriculture, those 2 industries, I would prioritize breaks and empowering workers to self-pace as the #1 adaptation strategy. And then the other 3 that I mentioned in my presentation: hydration, clothing, and mechanization. I think these are the top 4 practical and implementable ways that we can help workers with.
Thank you very much indeed, Andreas. That was fascinating. I imagine there'll be a lot of interest in the heat shield profile and early warning system as well. And that brings me on to our next speaker, Jerome Forcé from the German Red Cross based in Vietnam, who is going to talk to us today about some of that early warning and anticipatory work that the Red Cross has been doing to help informal sector workers protect themselves from the heat in that country. And just a quick intro to Jerome. He's got more than 12 years of experience in the humanitarian sector, mainly focusing on disaster management, disaster risk reduction programming, and climate change adaptation. And since 2018, he's been working on the impact of heat waves on vulnerable groups living in urban contexts. He's directly managed projects and strengthened local partner capacities in Bangladesh, the Philippines, Vanuatu, and now Vietnam. And he's also provided technical support to other projects in Asia Pacific and Africa. So, Jerome, we're looking very much forward to hearing about how the Red Cross is trying to put some of this advice and information into practice on the streets of Vietnamese cities. Thank you.
So yeah, thank you, Megan, for this introduction, and thank you very much for inviting me to participate in this event. So I will present our case study on outdoor worker in Vietnam, a low-cost, anticipatory, and science-based approach to reduce heat health impact. I will start very briefly by, I will say, the position of the Red Cross vis-à-vis heat wave. We define heat wave as a silent emergency, and very much for us, it's kind of unacceptable that for this silent emergency, there are simple, low-cost action to take to save lives. Our colleagues from the Climate Center have developed and published last year a heat wave guide for VNRC, for Vietnam and for other national society branches around the world to really look at what to do and how to develop partnership to work on heat wave. So in my presentation, I will focus, of course, on Vietnam, on outdoor worker. I will present the rationale, the why we wanted to work with outdoor workers, what is our standing point and approach. We have a very specific approach called forecast-based financing. I will explain a bit more about it. I will speak about the test we did, the result we get, and of course, I will conclude by learning and reflection points. So when we started to work on heatwave and outdoor worker in Vietnam, we conducted a literature review, and we met with a lot of stakeholders. And what we saw is basically heatwave is associated with an increase of hospitalization. In most of the, I think I lost the screen, sorry.
Yeah, I think we need to share Jerome's slides, if that's possible. Thank you, Jerome. Sorry.
No, but can you see my slide?
Not yet.
What is going on?
There we go. Thank you. Sorry. Apologies for that, everybody. Go ahead.
So yes, so when we did the literature review, we saw that we have an increase of hospitalization associated with heat wave, especially in Hanoi. But in the same time, we saw that outdoor workers have very limited knowledge about the heat stress and the impact of heat. In Vietnam, it's quite good because the Vietnam Disaster Management Authority mentioned heat wave as a disaster, which is not always the case in all countries. And the Ministry of Health has specific regulation for protecting the worker. But again, what we see is that those regulations are not enforced for informal setting, especially for outdoor workers. When we spoke with the stakeholder, what they say is basically they are very interested to work on heatwave, but so far they don't have any major project. And why? It's because still data are missing to basically make the case and engage into developing bigger programs. So because of that, we wanted to know a bit better what's going on with outdoor worker, and the German Red Cross and Vietnam Red Cross Society conducted 3 community survey, 1 in Da Nang and 2 in Hanoi. We interviewed more than 1,600 outdoor workers and swim dwellers, looking at the impact of heat wave in their daily life. And what we found out, of course, is outdoor workers are very exposed to heat wave. First, they work more than 8 hours a day under the sun, and the majority of them will have adapted some kind of measure to better resist to heat, such as increasing the drink, having some break during the day. But the main problem is that they don't have access to air conditioning. Only 7% of them have access to air conditioning during the day. They cannot access, for instance, the shopping mall or any places where it's fresher. In addition to that, they don't have cooling system in their house, and their house is very inappropriate in terms of insulation. As a result, 66% of them have 4 to 7 symptoms of heat exhaustion, with an average of 5.3 symptoms. And 22% go to the doctor during heat wave. And it's a big loss as well for them in terms of income, because the cost of healthcare is about 2 days of their daily income. So based on that, we really wanted to do something about outdoor workers in Vietnam. And our standing point was very much humanitarian standing point. What can we do which is efficient, low cost, and very rapid, very quick? And we would like to do it in a way which is anticipatory rather than to act after the heat wave and to deal with the suffering. So with that in mind, we use a new methodology called forecast-based financing. I will explain a little bit about forecast-based financing, and if you are interested in, you can follow the link. So basically, forecast-based financing approach automatically release funding when an extreme heat event is forecasted, allowing activation of early action. So in the Red Cross system, we have funding mechanism based in Geneva, in the International Federation of the Red Cross. And when a specific forecast of an extreme heat wave is released, money can be directly channeled to the Vietnam Red Cross Society to implement early action. So again, I have a problem with the slide. Here we go. So here we can see, so basically for the Red Cross, it's very important to know when to anticipate and when to act. It's why it's very important to have a forecasting capacity in place in the country. Here we can see the heat index developed by the Institute of Hydrology and Climate Change in Vietnam, which is the red line, and the Institute of Hydrology, in short IMN, in Vietnam, has developed as well a trigger, which is the orange line. It's 97 percentile, and basically, IMN can forecast 6 days in advance an extreme heat wave. And an extreme heat wave is an event when we have 2 consecutive days above the trigger, which is the orange line. If 2 consecutive days are above this orange line, automatically a warning will be released and the VNRC focal person will be informed of the coming heat wave. The VNRC will start preparing for early action. 3 days before the heat wave, if still the red line, the heat index is above the trigger or 97 percentile, then the early action will be implemented. Another warning will be issued, and funding will be automatically released from IFRC in Geneva to Hanoi, and then from Hanoi to the different chapters in the different cities. So to know when to act, of course, is very important, but as well we need to know exactly where to act. And for this, the German Red Cross and VNRC have developed an impact forecast mapping methodology consisting in compiling 3 layers of information. So the first layer, which is the first map on the left, is the vulnerability layer. So here we are looking at the percentage of the population, elderly population, and children under 5, as well as people with disability. Then we have a second layer of information, the layer of exposure, where we look at the percentage of people living in slum and in poor dormitory with no access to air conditioning, which is basically where the outdoor workers are living. And then we have a third layer of information, which is basically the hazard itself, the heat wave, and here we look at the hotspot, which are the high temperature in each single ward of Hanoi here. So by compiling the 3 layers of information, we are able to select the most at risk ward. Here we have selected in green the 10% the most at risk, and it's 15 ward in Hanoi. It is where we are intended to implement our project. So now that we know the impact on outdoor worker, we know as well the lead time, which is 6 days and 3 days, and we know as well where to act. We develop a theory of change to deal with the following problem. We know that the swindler and the outdoor worker, they never have the chance to find relief from heat during day and during night. During day because of their livelihood in the street, and during night because where they sleep in the slum. So with the theory of change, we look at possible solution and we come up with 2 activities, 2 early action to deal with that. The first one consists in operating community cooling center during the day for offering a cool place for the worker to rest. And those the cooling center are managed by Vietnam Red Cross Society volunteers. They provide water, tea, fresh towel to the visitor. They are equipped with fan, well fan, sprinkler. And in addition to the tent, we have as well cooling buses who go around the cooling center to attract the people to come to the center. And we have as well slum visits to reach out more people and to invite them to come under the cooling center. The second early action is the retrofitting of habitation in slum. And the aim here is to provide a cooler place for the person to sleep. That's the second early action we have selected. So after this selection, we did test the 2 early actions to see if they were applicable and efficient. So unfortunately for the retrofitting, what we saw it is that it's very impossible for us to implement the retrofitting in 6 days. It's far too short. And the main problem is that the authorization, we don't have the authorization from the authority to access the slum in a such short notice. And especially, we cannot build a temporary roof without authorization of the authority. So basically, the retrofitting is kind of acceptable by the inhabitants themselves, but it's not acceptable by the authority and by the owner of the premises. So we couldn't implement this early action. For the second one, the second early action, the cooling center, we have two tests. The first one in July and the second in August 2019. In the two cases, we have the heat index reaching 97 percentile. For the first test, we have 2 centers and the second one 4 centers and 3 buses. And basically here, we were looking at the feasibility, the relevance, the effectiveness and social acceptability, as well as the value for money of the early action. Next. So here we can see some picture of the early action, the cooling center. And I would like to invite you to look at a movie presenting the early action. I hope it will work properly. Here we go.
In July and August in Hanoi, alerted by early warnings showing an incoming heat wave issued by the Vietnam Institute of Meteorology, Hydrology, and Climate Change, or INHEN, Vietnam Red Cross and German Red Cross took anticipatory actions to reduce human health risks associated with extreme heat. Fully equipped centers with fans, coolers, and sprinklers were set up by VNRC volunteers before the start of the heat waves. The cooling buses traveled the streets of the city, stopping in places frequented by street vendors and bikers. One day before the occurrence of the forecasted extreme heat wave, the volunteers start welcoming the beneficiaries in the centers and buses. Their location was posted on public Facebook pages. The volunteers take care of the heat-affected people, following a protocol whose objective is to minimize risk in order to save lives. It's based on a series of procedures depending on the heat-related symptoms experienced by the beneficiaries and a constant health monitoring. In addition to the tents and buses, volunteers visited informal settlements to bring awareness and care to the vulnerable people.
Okay, so I want to stop the movie here and come back to the presentation. So what we have seen with the test in terms of result is that 100% of the activities that we intended to implement in the short time frame we had were implemented. And in terms of relevance, 80% of the visitors of the cooling center were outdoor workers experiencing symptoms of heat exhaustion. So it means that very much our early action targeted the right person because they did come to our cooling center. In addition, it is very effective because in the cooling center, we have a 10-degree cooler environment compared to the outside. And we have about 2,000 visits in 5 days. And about 70 to 95% of the visitors felt better after the visit to the cooling center. The outdoor worker as well understood the importance of resting during the heat wave, because we know that 73% visited the center for the right purpose. What do I mean is they came to the center to get rid of, or to reduce, or to avoid symptoms of heat exhaustion. In addition, they stay at least 10 minutes in the center, allowing themselves to have a break, and more than 40% came back, understanding that it was very useful for them. It was as well very socially acceptable by the authority as well by the people. It was very easy for us to get procedure and to get authorization for opening the center. And we have a huge media coverage. More than 20 TV crew came to the tent to film the early action, and the event has been broadcasted on national TV channel. In addition to that, it's cost efficient because the cost of one visit is less than €7. And actually, we are intending to reduce even further this cost to maybe €5. Of course, during this test, we have learned a lot, and we have improved further the design of the tents as a new design that you can see on the screen. And now we can achieve a difference of temperature of 14 degrees. More importantly, we have as well improved our procedure for welcoming the beneficiary and for managing the tent. So this procedure is made of 7 steps. The first one consists in, of course, welcoming the beneficiary, then offering them some drink, inviting them to loosen down their clothes, to remove their hat. We demonstrate to them in step 3 how to use a cold towel to cool down by putting the towel on their face, on their armpit, on their shoulder. Then we have a specific step where we assess the beneficiary health status. I will explain a little bit more later how we do that. If their health status is fine, then we will give them an awareness session about the symptom of heat exhaustion, and we will explain how to deal with that and how to reduce and prevent those symptoms. After that, we will give them in step 6 water containers so they can bring back home some water containers that they can use. And in step 7, we will invite them to join a Facebook page where we will basically share with them the forecast of heat wave, and as well where we will post more advice about how to deal about heat exhaustion. So now I'm going to speak about the assessment phase. It's quite simple. Basically, the beneficiary, when they arrive, the BNRC volunteer will ask them question about their symptom, and as well will assess if they have any emergency sign. If they don't have any symptom or signs, then we will continue with the task I just explained. So they will go to the awareness session, and then they will receive the bottle and they will leave the tent. If they do have symptom of heat exhaustion, then we will invite them to stay at least 20 minutes in the tent, and we will invite them to lie down, to put cold towel on their face, their neck, and we will provide as well drink to them like aerosol. After 20 minutes, we will reassess their health status. If there is no symptom, fine, they will leave. But if they do have symptoms, then we will call the emergency ambulance. And while waiting for the ambulance, we will continue cooling down the beneficiary more aggressively by putting a towel in all the body. If the beneficiary has emergency symptom from the beginning, then we will not waste time. Directly, we will call the emergency call, and the ambulance will come. And if during waiting, the ambulance we see that they have a cessation of breathing or cardiac arrest, then the volunteer will be able to perform CPR. Following those tests, the BNRC have conducted the feasibility study in 12 cities, and now they plan to extend the early action I just mentioned to 3 cities, Hanoi, Haiphong, and Da Nang, with 29 centers, 15 bars, and 4 slum visits, potentially reaching up to 25 outdoor workers. They will follow the same protocol. So for each of the 3 cities, we will have a specific trigger. And when the trigger will be reached, automatically money will be released from IFRC in Geneva to BNRC in Hanoi, and the money will be shared with the chapter in the 3 cities for implementing the early action. As for my conclusion, I want to first share that this project has been very successful in collaboration. For the first time in Vietnam, the Institute of Hydrology have forecasted heat index. Before the project in Vietnam, they were only used to forecast Vmax, temperature maximum. But now, because of the project, they have learned to calculate heat index. Another success is a collaboration with the University of Singapore for developing the standing operating procedure for the cooling center. We have as well success in terms of replication. As I just mentioned, the NRC want to replicate in 3 cities. But more importantly, the Vietnam Red Cross in Hanoi, with its own money, without waiting for the trigger and without waiting for the money from IFRC, they are implementing early action this year for a specific heat wave which happened 2 weeks ago. Another very important point, as I mentioned at the beginning, the stakeholders were interested to work on heat wave, but basically they were lacking of information and of data, and as well the knowledge about heat wave was not very shared across all the population. But thanks to the project, we have a huge coverage, and we believe that the visibility of heat and health issues has been increased dramatically in Vietnam. I would like to close by a reflection point. As you can see, the Vietnam Red Cross and GRC as providing a kind of practical use of the knowledge, scientific knowledge on heat and health. But I think as well, I would like to discuss the fact that the Red Cross movement could be as well a key contributor to the global learning on heat and health. The Red Cross around the world, they have the ability to reach the most vulnerable. We have the ability as well to conduct survey. Now students are trained to use mobile phone apps to surveys. We have done a survey with more than 1,600 people, and it's a kind of common practice now for the Red Cross to do surveys. And especially we have the knowledge of contextualized questionnaire because we have the understanding of the local context. Another very important point is in humanitarian sector, we are requested more and more to collect monitoring data for monitoring and evaluation, and we gather a lot of disaggregated data. Those data, I guess, could be very useful as well for the global learning, for social scientists, to better understand how the community is impacted by heat wave and its impact in general. So I would like to finish my presentation by inviting you to learn more about forecast-based financing by following the link. We have as well published a newsletter, online newsletter. If you want to register, you can click on the link and follow us. We have already about 10 short publications to share. So thank you. That's all for me.
Thank you, Jerome. Thank you. That's a really fascinating example of how you've been actually implementing this on the streets, and with the pictures and video, it gives us a real sense of what's happening. I'm going to ask 2 follow-up questions from the audience, just so that we then still have half an hour for panel discussion. So the most popular question that we had was, are the informal workers paid by piece rate? I'm not quite sure what that means, but in the sense of, did any of them talk about how they weighed up the time spent in the cooling centre against doing another job or selling more goods, which obviously is not so much a consideration for people who have employers who sanction these breaks, etc. Really important question. And the other question, I think, of which everyone is probably thinking of right now, is how will the implementation of those cooling centres work during the COVID-19 pandemic? How have you incorporated that into the work? Although if I remember rightly, Vietnam has not had very high level of infection rates.
Yes, thank you. That's 2 very interesting questions. So for the first one, actually, it is quite difficult to convince the street worker to come to our tent, because as you can imagine, the time they spend with us is time they don't spend with the customer. However, with a bit of convincing from the local Red Cross, we did manage to have a lot of visits. And in any cases, as you can imagine, there is less customer in the street when it's very hot. So somehow we did manage still to have a lot of people coming in. It was as well a bit difficult to get the local builders, because street vendor is not only the target we have as well local builders. And here we have really to think about when it's convenient for them to come. So for instance, they really enjoy coming at specific break after their duty, but not during their work. And that's a bit of a pitfall, because we didn't manage to invite them to have break during their working hours. They just came after, so for lunch break, or in the afternoon after they are finished working. So we still have to find a way to engage with them, maybe with their employer, so they can come, but it's not so easy. For the question about COVID, yes, you are right. In Vietnam, luckily, we don't have so many cases. And so now we start to have so many cases since yesterday. So we are still planning to test one more time the early action this summer. However, we have done some basic adaptation to COVID situation. So basically, the tent that you have seen, now we are opening up the curtains to have more air coming in, coming out. We may not use a sprinkler. And in the same time, we want to put some partition inside the tent. Besides that, we have hand washing station at the entrance, and we will ask the people to keep their mask during the visit of the tent. Saying that if the situation degrades in Vietnam, unfortunately, we may not have the authorization to open the center because Vietnam is very strict when it comes to COVID, and there is one regulation consisting in avoiding any meeting for more than 10 people. So as you can imagine, if this regulation is in place, if there is more case, we will not be able, unfortunately, to open the tent. That's the problem we have.
Well, I very much hope that isn't the case, Jerome, and that you're able to deploy the tents and the buses as planned. Well, thank you so much to all our three presenters for the really fascinating and different presentations from the very global level down to the street level, which I think helps to give an overview of where things are at in terms of occupational health and heat. So we have about half an hour now for our panel discussion. And so we're going to ask people to put general questions they may have for the panelists into the Mentimeter again. I know that we've already had a lot of specific questions, but if there's anything broader that you can address, that the panelists can address for us, that would be very useful. If you could add the questions in the Mentimeter, and we'll see which questions come up most popular. But while you're doing that, I'm going to ask a broader question to our three panelists, which is about the intersection between climate change and addressing occupational health risks when it comes to heat. And I'll start with Tahmina. How have you managed that conversation with governments when you're talking about this issue and climate change? Do you find it helps to discuss it in the context of climate change, or does that complicate things? What approaches have worked, and what have you found difficult when it comes to sort of putting those two subjects together?
Thank you very much for this very interesting question that I'm not sure there is a specific answer as yet, but probably I'll give you some elements that could inform probably the audience to make up their minds. The first thing is that ILO is a tripartite organization, meaning that it is composed of three main actors in the world of work. It's the government, employers, the workers. So every single endeavor in a specific area that we do is a result of the collaboration between these three actors. So by definition, the very fact that the organization is providing evidence-based knowledge on the issue and does the research on the intersection between climate change and occupational safety and health is already the result of this collaboration. So we support the governments, employers, and the workers who in an equal manner participate in this dialogue to actually raise awareness by our research and provide arguments, as you say. But also I should say that heat stress is not something new to the world of occupational safety and health. Already there is a Convention 120 on hygiene in offices and commerce. There is a General Convention on the Occupational Safety and Health, number 155. They all already integrate the issue of heat. Obviously, as you say, climate change is a new dimension. So our role, as we see, is to provide this information that is crucial, the message of which is that taking care of the nature of our environment and addressing the climate change is for the benefit and the responsibility of everyone. This is the message, I think, which is important, because in a dead planet, there will be no jobs. One, it is an economic argument, and the very constitution, the foundation of the ILO is labor is not a commodity. So we human beings, as part of the nature, we have to take it as a common responsibility to protect ourselves and the earth.
Absolutely. I guess it's as you say, it isn't something new as an issue, but it is being exacerbated by climate change. Andreas, do you have specific conversations around climate change when it comes to the work you're doing, or are you seeing it more as a a short-term issue and presenting it as such?
Uh,
Well, you know, what we're trying now to do is to support policymaking. We're trying to take evidence developed with a scientific method and transform it into policy. And in my short experience so far, to do that, you need as little uncertainty as possible. So, with this in mind, although everybody considers climate change, and we do, and there is often mentioned within policy, however, we're trying to make it as evidence-based as possible, because as you may understand, these policy may end up being used to court, so you cannot really be a bit too vague about the way you phrase things. So with this in mind, although when we try to educate workers, when we educate employers, we do discuss that things will get worse, and in fact, this is the point of creating this platform. However, when we try to create policy, we try to do it as evidence-based and short-term as possible, to be based and grounded on solid evidence.
Right, that makes an awful lot of sense. And Jerome, I know that for the Red Cross, climate change is a major issue, but in general, but is that a discussion you have in Vietnam, or is it less relevant to those sort of policy discussions and getting things done, as Andreas would say?
So the Vietnam Red Cross Society is very much aware of climate change, but they see more the climate change as an impact of increasing the number of cyclones and the intensity of cyclone and flood. They see a bit less emergency to work on heat wave yet, because it's difficult to know what is a normal heat wave and what is an heat wave which is induced by climate change, and what is the difference. So it's not so easy for them yet to see that. In terms of policy making, the Red Cross movement at global level is pushing the agenda for considering more climate change as a priority, but it's maybe less the case in each single country, especially in Vietnam. The NRC, the Vietnam Red Cross Society, don't have if you want, the leverage to lobby for changing any policy. So really they position themselves more as humanitarian, but with specific facts that now they want to act before. That's why they use this forecast-based financing approach before rather than after, as they were used to do. But really, they cannot really have a strong impact in shaping the policy at governmental level for climate change. They cannot say that.
Right, absolutely. There is quite a large gap there, which is a hard one to tackle. Going to the audience questions now, we've got an excellent one that is our top voted question, which is how do we move beyond having the responsibility of safety being on the worker and instead putting that responsibility onto the employers and government so that it's addressed in a much more structural way. Now, I think in the presentations, our speakers did address some of the work that's being done on that already, but I'd like to ask you in turn, with relevance to your own work, what do you see as the main obstacles to moving beyond it being an individual responsibility and it being a broader responsibility, and how do you try and overcome those difficulties and push forward on that understanding that this is something that has to be tackled on the government and or the employer side? Tahmina, can we start with you? I think that would be more on the government side. I think you need to unmute yourself. We can't hear you right
now. From the point of view of law, which is a general principle in many countries across the globe, and the responsibility is obviously in the first place is on the government, then it trickles down to the employers. But as the question already suggests, in practice, in fact, how do we move beyond having this responsibility being solely on the worker? I think it's important to always start with this legal dimension of the topic, meaning that the previous question on the issue of whether there have been any legislative or legal changes increasing the safety of workers vis-à-vis the heat stress was a very good one. For instance, in Cyprus, there is a decree by Ministry of Labour addressing specifically the issue of the heat stress, especially when the country is exposed to extreme temperatures during the summer months, which sets the maximum of temperature where the worker has a right to stop working. 30 degrees, there is a work stoppage during the summer. So this kind of framework helps the worker to claim their rights, to implement their rights, to refuse to work if there is a considerable risk. But I think that in a more pragmatic and more long-term perspective to address the issue, I think social dialogue, this is the institutional perspective we would like to advise, to have this dialogue between the workers, employers, and the governments in order to implement effectively such a concrete measure, for instance, in the Cyprus example. But it's not always the case. But still, I think that the general principle of precaution and prevention of hazards at workplace rests upon the employer, thanks to the regulatory intervention by the government. So the answer is always not a very straightforward one. It's just several elements that can try to give us a little bit of understanding of the way to go. So I think that it's
just as a follow-up, do you see many of these social dialogues taking place? It struck me that you can mention that.
I think that in the case of in the case of, for instance, countries that are most exposed to the heat waves, this is a good example. I'm not aware whether, for instance, the example of Cyprus that I gave you when there was a decree, this is a result of the social dialogue. But I think that there are obviously many examples across the world where through social dialogue, people reach collective agreement with their employers on the issue related of work hours, the changing of the working hours, shifts, protective equipment. We encourage the partners, the social partners, to go in that direction, because I think that every context has very specific institutional, legal, social, economic aspects. There is no one fit-for-all answer or a framework of action, but the basic principle is that primary safety is on the governments, and the governments delegate their responsibility to the employers through their regulatory interventions. But the workers, of course, can also participate, because I think that in the context of the workplace, the participation of workers in these endeavors is also important. That's why in our report, we also say that there is individual participation through personal measures that you can take. But I think that in terms of infrastructure, risk assessment, in terms of general measures related to alleviating the stress of working in such hard ambient factors, it lies upon the employer. In order to make it the law to the reality, or principle into the reality, I think this collective dialogue is important.
Right. And in your work, Andres, do you see or encourage, indeed, instances of that type of interaction between the workers and the companies that you've been testing some of your tools with? And are there any sectors in particular that you think are kind of blazing a trail for others to follow?
Yeah, absolutely. Being on the ground is very helpful with this regard. There is lots of training and education, especially in the construction industry, where workers have to get at least some, even in small companies, they have to get at least a little bit of training and education with regards to health and safety. So in that respect, we're trying now to add to inspire companies to add to that training, to add heat stress, although sometimes they do touch upon it. we're trying to encourage them to add a bit more information on this. And to do this, what we're trying to do is, by the way, I think Tahmina's response was spot on this, but the only thing I would add on this is that we're trying to convince governments and employers to take on the responsibility by showing them the economic impacts, which in fact is what the ILO report did as well. It quantified the economic impacts, but we're trying to see that being on the ground and quantifying it there on a minute by minute basis, seeing how the workers are behaving, and trying to quantify it in a very, very accurate way. And this, I think, helps convey the message that, if it's not only health, it's not only long term, it's right now, it's this month's paycheck would be, bigger by this much if it wasn't for this problem. So, just to summarize, yes, we're trying to increase education. I think it's really important. Construction is organized in this regard. I think in my experience is by far the most organized industry with respect to addressing occupational heat stress issues. I think other industries could learn a lot from what's happening in construction, and stressing the economic impacts. I think it's very important.
Absolutely, thank you for that. Those specifics, and Jerome, I mean, just applying this directly to the aid sector. Do you find in your experience that aid agencies are increasing the amount of work they're doing in order to encourage a wider system shift in terms of addressing heat risks in the countries that you're working in?
Well, I don't really know if it's the responsibility of the Red Cross to try to shape the policy and to influence policymakers when it comes to heat wave and heat stress. But what we noticed when we started to work on heat wave in Hanoi is we met with the main stakeholder here, the Ministry of Health and ILO as well, and many other agencies. They all say the same. In Vietnam, they have interest in tackling the issue of heat wave and maybe even to impose more regulation. But what is missing, according to them, is a lack of specific data in Vietnam about Vietnam and how heat wave impact Vietnamese workers. That's their problem. So as long as they don't have those data, they cannot really make the case and really push for it. So in a sense, they are happy to see us, the humanitarian sector, to work on heat wave and to give more light on this issue. But still, I think it's a long way before so the regulation can change and then trickle down first to the formal working context, and then even more to the informal outdoor worker context. So I think it's a long way in Vietnam before it's happening. So that's pretty much my answer, because I really think that it's not so much where we have a leverage to influence us, Red Cross, in general. We see still ourselves as humanitarian, bringing humanitarian response to the issue rather than a policy capacity.
Right, but I guess the fact that there is a humanitarian need there suggests that there is a big policy gap that needs to be filled, just by the very kind of virtue of having these kind of interventions. So that's interesting to hear. We're going to move on to the next broad question now, which I think is probably very relevant in the context of COVID-19, which we haven't addressed so much in this discussion so far, and that is what heat index would you recommend to use for indoor workplace assessment? I mean, obviously, this question is not specific to personal protective equipment and medics working in using this equipment, but it is something that's probably coming to the fore. So, Tahmina, I'm just wondering what ILO has been doing on this aspect, whether you have anything new or whether you are already advising your members on this issue of indoor assessment.
Apologies, my mic was muted. No, I just think that from our side, also in line with our previous discussions, what I wanted to say is that as an ILO, we collect also in various forms the practice of the states, because I think what one state or country does to address specific challenges in the world of work is also useful for countries to learn from each other. So in relation to the question of the Humidex, we don't, in our report, we don't really provide any particular recommendation on what can be used as an index for indoor activities. But what we do, for example, we provide some examples of different countries. For example, in Canada, and this is one example of the collective, the social dialogue, employers and workers make use of the threshold values of the Humidex index, so that this will serve them as a trigger to implement the plans that they have developed to address the heat stress in workplaces. According to one of the Canadian collective agreements between the workers and the employers, the company and the union agree that on any shift, for example, when the Humidex reading equals or exceeds 39 degrees, workers, they can choose either to be paid an additional 25% of their regular hourly rate for the shift, or to be excused and stop their work. So I think that these kind of examples are very relevant for us, and in this report we try to give few of those issues when instead of being prescriptive, we really provide the solutions that have been found that responds to needs of concrete in a concrete setting between specific groups of workers and the employers. So this is, I think, this is one way for us to continue doing, to collect such an examples and so that the countries and employers and workers can learn from on how potentially they could address it.
Megan?
Right, thank you. And Andreas, have you done any specific work on this area too?
Megan, could you ask the panel to turn on the videos, please, so we could see them?
Oh yes, sorry. And when speaking, if you could turn on your video, that would be great. Thank you.
And leave them on so we can see the panel, please. Thank you.
Okay, thanks. Thanks, Paul. Yeah, go ahead, Andreas.
Yeah, okay. Yes. So we've been collaborating for the last about 1.5 years with a number of scientists around the world to gather data and combine them together with our own data to answer this question, because it has been a growing issue for several decades now. We've been doing a literature review, and we found more than 300 indices out there. The best, and what we're trying to do is to correlate them with the data that we collect on the ground in using the field studies that we have been doing in the last 5 years. And the top three that we found so far is the indoor WBGT, the outdoor WBGT, and the UTCI. These three in this order have been the ones, the top three correlating best with the occupational heat strain that we have been recording in our field studies with workers. So since the question is relating to indoor, then it would be the indoor WBGT that we feel that is the most appropriate one.
And Jerome, I don't know if you've done any particular work on this issue, maybe perhaps less so if you're with informal workers, right?
No, we didn't do anything on indoor, but for us, for the heat index, for outdoor worker, we use a percentile-based heat index. Because for the forecast-based financing approach, we are only interested in catching the extreme heat wave, which is a kind of event to happen 1 in 5 years. And for Hanoi, when the Institute of Hydrology and Climate Change calculates the trigger based on percentile for 1 year, 5 years return period, the percentile is 97%. So that's the kind of percentile we are looking at for triggering early action. But indoor, we didn't do any calculation. It's not really a focus of our work.
And I'm going to direct the next question back to you again, Jerome, actually, if that's okay, which is basically asking about how heat alleviation techniques can be applied to subsistence farmers in, for example, rural West Africa, where there might not be, a good electricity supply or, in fact, a good water supply. I'm thinking that the Red Cross may well have done some sort of research on that kind of thing, because as Tamina said earlier, West Africa and agriculture are one of the highest risk categories here.
So what is important to understand in the methodology we have proposed is that really we wanted to be sure what we propose as an action is well adapted. So we don't pretend that setting up cooling center is a solution for every place, any places. What is very important is we start by a literature review, a very in-depth survey. It took us six months to interview 1,600 people and to really gather data and to really understand what needs to be done in the context of Vietnam. In Vietnam, the water is not an issue, electricity is not an issue, so it was convenient for us to come up with necessary action. In West Africa, definitely it will be different. My only advice will be to start by conducting the survey to better understand what are the regulations, what are the needs, what are the impacts of each specific population. What we have to see is too often we want to replicate one action to different country, different context. I don't think it can work. If we have to remember something about this presentation, is really we are sure that the cooling center is appropriate to Vietnam because we can back it up by an in-depth study. And I don't know yet what the Red Cross is doing in farmland in West Africa. I'm guessing we are still starting to work there. I'm not aware of all the Red Cross movement work, unfortunately, so I cannot say more than that.
Okay, Tamina, I don't know if you've done any work on this specifically when it comes to agriculture in places that may not have a very developed infrastructure in terms of utilities and so
on. We haven't done specific work, but I think that what we have done, again, in the framework of the report, in addition to providing data on the projections that we have by 2030, I think we provided some good examples that some countries have adopted that could be replicated possibly. And there I can only name, for instance, some examples that we found across the globe where the employer provides basic, let's say, water supply with salt, which is very important. But also we thought that one technique that has been used by some countries is, especially in subsistence agriculture, is to have different shifts, working hours to be changed to the time of the day where there is less exposure, when it's cooler to work, something that has been used very widely and can work. Obviously, these are just very rudimentary, let's say, some of the techniques that could be replicated in different contexts. But to have a very focused, I think this is something that we should observe and monitor and see, because the effects of the climate change is not only going to be felt in some of the hottest parts of the world.
Right, I think it's interesting to link that up with what you were saying earlier about it being a potential drive for migration, because if it becomes difficult to address some of these extreme heat stresses in places that lack infrastructure to enable that to happen, it could actually be a key factor in pushing people away from their homes and the lands that they're trying to work on. We're just going to have one more question from the audience. I'm going to put this specifically to Andreas. It is also interesting in the context of a lot more home working going on now. But the question is, how do you counteract sealed glass box office building culture which completely depends on air conditioning, and people sit there in their overly cold offices compared with outside temps. I mean, obviously, you know, this is something that is a key concern for climate change as well. So I guess it's like an overcompensation. I mean, I work from home the entire time, and I'm sitting here right now sweating because it's quite hot in Australia. I don't have my aircon on because I try not to put my aircon on. I think I may be suffering from heat stress fairly shortly. I'm going to have a drink of water while you answer this question.
Okay, well, this is very prevalent also in countries like Qatar, for example, where you see on one hand outdoor workers working in the heat, and then you see in the offices having way too low temperatures. And in fact, this is really relevant for this time that we're experiencing with COVID, where use of air conditioning is showing that it's actually impacting the amount of time the virus can survive outside the body. So how we can address it? Well, in my view, it again goes back to two issues: education and economics. There's no way. I don't think there's no other way to influence people. Trying to find we can use technology to try to find more efficient ways to cool buildings. It's really important because it's pushing climate even further. Air conditioning is going to be one of the major contributors to greenhouse gas emissions, especially in the coming decades. So it's really important that we also, part of the research that we are doing should be geared towards that. And I know there's a number of initiatives that are starting now on this regard. So again, going back to work-wise, I think it has to do with technologies being developed and showing the economic impact. First of all, on the business, but also sort of showing some of the health impacts related to working in an environment that's sealed and it's low humidity, very dry and very cold. And I think the COVID situation may be a nice way to start, showing that it's it may feel good, but it probably has a number of health effects that are not that great, especially in an educational environment.
Absolutely. I think that's a very good place to kind of end the discussion. I mean, we've covered a really wide range of issues today. And a couple of things that have sort of come out of the discussion for me has been that, this is very much a work in progress, and that there's so much more to be done in terms of developing not just policy guidance for specific settings beyond the kind of global level, but also the tools, the practical tools that employers and workers can use, whether it's a public cooling centre, one provided by aid agencies, an online personal profiling system, and indeed total lack of provision for some people, who may just be out of the loop when it comes to this, and understanding, awareness and ability to access any means of dealing with it. So just very briefly to wind up, I'd like to ask each of the panelists just to have a final kind of word just on where you would like to take your work next, what is the priority for you, and what you would most like to see change in the coming year or two. Tamina, we'll start with you. If you could keep this really brief, because we're nearly at the end of our time now, that would be great. Thank you.
I think that the path ahead is in the last question. What can we do to counteract this single glass box office building culture? And this shows the real challenge ahead, which is to introduce sustainable practices in the workplaces generally, because in addition to adaptation, mitigation is one of the important way to go ahead. And we can do it by us in the workplaces adopting, should I say, responsible consumption patterns, and also to use the resources responsibly. So because everything is so interconnected.
Absolutely. And Jerome, I will bring you in now. From your perspective, what's the key issue and the key task facing you?
Well, I think for me, what I would like to see is to see more Red Cross and society engaging in the issue of health and health. We have the Vietnam Red Cross Society, the Bangladesh Red Cross is interested as well, in Pakistan. We have several countries, but still it's not all the Red Crosses around the world who are engaging on the issue of health and health. In Europe, we have the German Red Cross and the French Red Cross as well are doing some activity, but it's not yet all around the board, all around the world. So the guidelines that I shared at the beginning of my presentation will help dramatically in pushing national society to engage more on that. And hopefully not only the Red Cross, but as well some other humanitarian agencies. Another point which is important for me is I would like to see more cooperation humanitarian sector with social scientists and with as well forecasting agencies. So one of the key things we have achieved is really to work with Singapore University, as well to work with the Institute of Podology. And I think something should happen more, not only with in Vietnam, in more countries, because it's beneficial for both. We need to learn from social scientists about how to develop questionnaire, how to engage into this discussion on health and health. But I guess as well, the social scientists could take advantage of our presence at field level to ask questions, to learn from the population. So we have as well a lot to offer in this learning. And for the social scientists, for the forecasting agency, we need their forecast. But again, it's interesting to engage in discussion with them because we need a specific kind of forecast. We just don't want temperature. We want to have heat index. We want to have specific trigger, specific value for which we believe will have impact in population. So I want to see more and more humanitarian sector working with scientists, social scientists, and forecasting. That's my second point.
Thank you. Andreas, does that speak to you in any way? How do you see this kind of cross-sector collaboration going?
Yeah, well, I think in the last decade there has been a tremendous amount of data being gathered and projects being run around the world. And I'm looking forward to seeing all these data being published and then supporting evidence-driven policy. I think we need to move to the next level. I think now there's an enormous amount of data. Like I said, I'm hoping that next year or so there's going to be even more unprecedented amount of data being published. So I think in 2 years we will be in a very good point where we can actually start developing policies around the world and then educating workers and start making a change.
Well, as a media worker, I found this a very interesting and fruitful discussion today, and I've really learned a lot. And I think outreach to the media is going to be something that could be key in helping the work of all three of our panelists, because I think that actually there may be more interest in some of this than there has been up to now, and that's likely to increase. So don't forget. And in fact, what Jerome was saying about the 20 TV crews or however many it was coming to the cooling centres, and there's something to see as well, that always helps in terms of getting it into the news. With that, I will thank all three of you and Farouk for operating the Mentimeter during this conversation, which I think has been a really good way to float up some of the key concerns of the audience. Yes, with that, I'll hand back to Joy in order to wind up the dialogue. Thank you very much indeed, everybody. Over to you, Joy.
Thank you.
I think we can't hear you, Joy. You may be on mute. Still can't hear Joy at this point. Jason, Perhaps you would like.
So I'm not on mute. Are you able to hear me now?
We can. Sorry, Joy. Go ahead.
Okay. Hi. Can you hear me now?
We can hear you.
Excellent, excellent. So sorry about that. Well, thank you again for facilitating the conversation today, and to Andreas, Tamina, and Jerome for sharing a lot of lessons and insight to this very complex issue. I certainly learned a ton, and I hope that everyone else did too. I just wanted to also share some opportunities that are coming up for all of you to stay engaged in this topic of occupational heat health. We will be having a new section on our website focused on this topic. You'll be able to find all of the resources that were discussed and presented today, and we're hoping that this will be a focused area of the website where we can really build out a lot of resources, great case studies, and show what's going on and progress being made on this topic. We will also be starting up in September some thematic coordination calls that are going to happen on a fixed date every month. So whoever wants to call in from around the world, wherever you are, whatever topic that you work on, just to listen in and learn what's happening. We'll be advertising these in our digest when the dates are going to be. We also expect that there's going to be some master classes that are specifically addressing some of the issues that we heard today. And there will be some new reports coming out probably this fall, and additional technical collaborations with some ongoing projects like the Heat Shield project, as well as the work that Jason leads on the scientific committee of thermal factors. So we do encourage you to stay involved, to keep us abreast of what is new and happening in the community that you find is relevant and should be shared with others. We'll be communicating through our website and the digest every month, so please do subscribe to the newsletter so you can find the dates and know what is happening. So again, I would just like to thank everybody for tuning in, for being committed to doing this work and addressing heat risks, and hope to see everyone again soon in another online event, and at some point for our forums back in person. So thank you all today, and we'll end here.